Have you ever been told that every pet should be spayed or neutered, no questions asked? Or maybe you've heard the exact opposite, that these surgeries shorten lives, cause cancer, or completely change a pet's personality. So what's actually true? Today I'm separating myths from evidence by looking at what really happens inside a dog's or cat's body after sterilization, the genuine medical benefits, the potential long-term risks, the situations where delaying surgery may be better, and why veterinarians don't always agree on the best timing. This isn't about convincing you to choose one side. It's about understanding the science so you can make an informed decision with your veterinarian. Spaying and neutering are among the most common surgical procedures performed in veterinary medicine. Millions of dogs and cats undergo these operations every year. Despite how common they are, they're also among the most misunderstood. Some owners believe they're completely risk-free. Others believe they're harmful in every circumstance. The reality lies somewhere between those extremes. The effects depend on factors including species, breed, age, sex, genetics, lifestyle, medical history, reproductive status. There's no single answer that applies to every pet. Let's begin by understanding exactly what these surgeries involve. What actually happens during surgery? There are two different procedures. Female pets, spaying. Most modern spays involve removing both ovaries and the uterus. Although techniques vary by country and veterinary practice, the ovaries produce estrogen, progesterone. These hormones regulate heat cycles, pregnancy, mammary development, bone metabolism, muscle maintenance, fat storage, behavior, urinary tract function, immune interactions. Once removed, hormone production falls dramatically. The reproductive cycle permanently stops. No more heat cycles, no pregnancies, no ovarian diseases, male pets, neutering. The testicles are surgically removed. This permanently eliminates sperm production. Testosterone production also drops dramatically. Testosterone influences muscle mass, bone growth, territorial behavior, roaming, urine marking, libido, competition between males. Over weeks to months, the body adapts to its new hormonal environment. What happens inside the body afterwards? The surgery itself usually heals within 2 weeks, but the internal hormonal changes continue for months. These hormones communicate with nearly every organ system, including the brain, the skeleton, the muscles, the immune system, the liver, the skin, the cardiovascular system, the urinary tract, the endocrine system. The body gradually reaches a new hormonal balance. Most healthy pets adapt extremely well, but these changes can have both benefits and drawbacks. Proven advantages: preventing unwanted litters. This is the most obvious benefit. Reducing accidental breeding decreases the number of homeless animals entering shelters. Eliminating uterine infections. Female dogs can develop pumetra. Pumetra is a severe bacterial infection of the uterus. It commonly affects middle-aged and older intact females. Without emergency surgery, it can rapidly become life-threatening. Removing the uterus completely prevents this disease. Eliminating ovarian disease. Once the ovaries are removed, ovarian tumors cannot occur. Reducing mammary cancer risk. Timing matters. Studies show that dogs spayed before or around their first heat generally have a lower lifetime risk of developing mammary tumors compared with those spayed after multiple heat cycles. The magnitude of the benefit varies among studies and breeds, so owners should discuss timing with their veterinarian. Cats also experience a marked reduction in mammary cancer risk when spayed before repeated heat cycles, preventing testicular cancer. Neutered males cannot develop testicular tumors because the testicles are removed, reducing benign prostate enlargement. Older intact male dogs commonly develop benign enlargement of the prostate due to lifelong testosterone exposure. Neutering greatly reduces this risk, reducing roaming. Many intact males travel long distances searching for females. Roaming increases. Vehicle accidents, dog fights, lost pets, injuries. Neutering often reduces this behavior, though it may not eliminate habits that are already well established. Reduced urine marking. Many male cats spray less after neutering. Dogs may also mark less frequently. Potential disadvantages. No surgery is completely without consequences. Hormones exist for a reason. Removing them changes normal physiology. Increased obesity risk. Metabolism slows modestly after sterilization. Appetite may increase. If food intake isn't adjusted, weight gain becomes much more likely. Obesity then increases risk for diabetes, arthritis, heart disease, joint problems. Reduced lifespan? Fortunately, this is largely preventable through appropriate diet and exercise. Orthopedic concerns. This is one of the biggest areas of ongoing research. Sex hormones influence growth plate closure in young animals. If large breed dogs are sterilized before skeletal maturity, bones may continue growing slightly longer than intended. Some studies have associated early sterilization in certain large and giant breeds with increased rates of conditions such as cranial, cruciate ligament rupture, and hip or elbow disorders. The risk varies considerably by breed, sex, and age at surgery. This does not mean every early neutered dog develops orthopedic disease. It means timing can matter, particularly in breeds already predisposed to joint problems. Urinary incontinence. Some spayed female dogs later develop hormone-responsive urinary incontinence. Large breeds appear to be at higher risk. Many affected dogs respond well to medication. Coat changes. Certain breeds may develop fluffier coats, softer fur, changes in texture. These changes are cosmetic rather than harmful. Hormone-related behavioral changes. Neutering often reduces sexually driven behaviors. However, fear, anxiety, aggression, learning, social interactions are influenced by genetics, environment, training, early life experiences, and hormones together. Sterilization should not be viewed as a cure for behavioral problems. Cancer research. This is perhaps the most controversial topic. The science is nuanced. Some studies suggest early sterilization in certain breeds is associated with a higher incidence of specific cancers, while other studies show reduced risk for reproductive cancers or no significant overall difference. Examples that have been investigated include hemangiosarcoma, osteosarcoma, mast cell tumors, lymphoma. Importantly, association does not prove that sterilization causes these cancers. Breed genetics, body size, lifespan, and study design all influence the results. This is why many veterinary specialists now recommend individualized decisions rather than a one-size-fits-all approach. Surgical risks. Modern veterinary anesthesia is generally very safe, especially after physical examination, blood testing when appropriate, careful monitoring, pain management. However, every surgery carries risk. Possible complications include bleeding, infection, anesthetic reactions, delayed healing, internal bleeding, incision complications. Fortunately, serious complications remain uncommon in healthy animals when surgery is performed by experienced veterinary teams. When waiting may be better, some veterinarians recommend delaying sterilization in selected dogs. Examples include large breeds, giant breeds, working dogs, athletic dogs, dogs still undergoing skeletal development. The ideal timing depends on the individual animal rather than a universal age. Cats generally mature earlier, and early sterilization is widely considered safe and effective for population control and prevention of reproductive disease. When spaying or neutering may not be appropriate right now, surgery may be postponed when a pet has an active infection, poor overall health, uncontrolled endocrine disease, certain heart conditions, anesthesia risks requiring further evaluation, pregnancy, depending on the clinical situation and owner goals. Your veterinarian may recommend stabilizing these conditions before elective surgery. What happens if you never spay or neuter? Keeping a pet intact also carries medical and behavioral considerations. Females remain at risk for pumetra, ovarian disease, pregnancy, repeated heat cycles, mammary tumors, especially after multiple heats. Males remain at risk for testicular tumors, benign prostate enlargement, roaming, territorial aggression in some individuals, urine marking, accidental breeding. For some carefully managed breeding animals under responsible veterinary care, remaining intact may be appropriate. However, it requires diligent health monitoring and management to reduce risks. The current scientific consensus: veterinary medicine has evolved. Rather than asking, should every animal be sterilized immediately, experts increasingly ask, which pet, which breed, what age, what lifestyle, what medical history. Individualized recommendations generally provide the best balance between disease prevention and long-term health. Spaying and neutering are neither miracle procedures nor inherently harmful. They are powerful medical interventions with well-established benefits and real, but generally manageable, risks. For many pets, sterilization substantially reduces the risk of serious reproductive disease and helps prevent unwanted litters. For others, particularly some large breed dogs, the timing of surgery deserves careful discussion. The best decision is rarely based on internet opinions alone. It is made by considering the individual pet's breed, age, health, environment, and the latest veterinary evidence. Every animal is unique, and that means the best choice should be unique too. If you found this video helpful, consider sharing it with another pet owner. Subscribe for more evidence-based animal health content, and let me know in the comments, when was your pet spayed or neutered, and what advice did your veterinarian give about timing?